Hello everyone, today is September 19th, 2019, and I'm going to read from some newspapers I have been reading to you about some topics. These topics today are specific to Wisconsin and Wood County. So, if you are not interested in either Wisconsin or Wood County, then don't listen. So first I'll talk about Wood County. This article is from the Hub City Times. It's dated Wednesday, September 11th, 2019. It's called Wood County Looks into Solar Initiatives. And so we have the County Board Chair, Doug Machen, M-A-C-H-O-N, and he is explaining to us what they exactly have. There was a $25,000 appropriated in each of these funds. So he's saying we've got some money. I'm kind of like in the middle of a conversation here. And as he goes on, Machen said the funds were established in manner that department heads would come forward to the executive committee with concepts, and the committee would award money out of one of the funds for the project. And the first fund was designed for energy efficiencies and infrastructure initiatives, while the lean fund is dedicated toward improving processes. And this is I really like this quote by Mr. Machen. He says, anything that would lead to synergies or efficiencies or symbiotic relationships or things like that. So to me, he's saying these funds were made available to our county for people like me to make decisions on what would be best energetically that combines solutions on how to create renewable energy. He later goes on to say to someone else, I'm not sure if this is him, I think this might be someone else, and they said, I think it's Supervisor Lichtman, L-E-I-C-H-T-N-A-M, says, the other thing that I've looked at, and I don't know if the rest of the committee has, is Dane County is the only other county that is doing anything substantive with solar right now. Wouldn't it be wonderful in the middle of the state if Wood County could take the initiative and did something of the things that you are now hearing about? And I really think that's important for Wood County to consider. Wood County wants to become a elderly retirement community mecca center. So we need to keep the cost of things in a relatively low place, because when you are gearing towards assisting the elderly, you are assisting people that have a limited income. Even if they have pensions, 401ks, whatnot, they still have a limited income. So you want to keep the cost of living accessible to people that have limited incomes. It's a socialistic aspect because you're going to have Medicaid, Medicare, and other social programs assisting and caring for people, but you don't want to make their daily life resources unattainable. So I really like this idea. I do hope that Wood County gets very serious about renewable energy, because I know Tesla is promoting and creating home solar panels that you can purchase and you can finance through the Tesla portal. So if Wood County and Wisconsin don't want to do it, homeowners that have the ability can do it themselves. With the storms we just had this last summer and the amount of time power was down in some areas, it's really time to start to seriously consider how to generate power off the grid if you're in an area that's a little more isolated. So I thought that was a really great article about becoming more cohesive with our environment and protecting our environment, which makes us healthier as a species and other people. Now I'm going to start to talk about, let's see here, where does this start? The opioid crisis in the state of Wisconsin. Okay, so this article is out of the Marshfield News Herald. It's dated August 3rd, 2019, and it's about an application that can help opiate addicts, or just addicts in general, but it's being funded to help opiate addicts. Researchers from the University of Wisconsin-Madison say their app may one day help prevent relapses in patients recovering from opiate addiction, or probably any addiction. What the app does is the app monitors that person's behavior, support services, and they connect to the patient support services just in time before an opiate relapse actually occurs. It does this by using cell phone data such as a person's location, the content of their text messages, and who they call to identify signals that may indicate a patient is at risk for relapsing. Is monitoring the communication with who you are talking to. So if you get in touch with someone you used to either use or buy opiates from, the phone is going to alert you and say your behavior is an indicator of relapse, so that you can seek out services before the crisis becomes worse. He's this person that they're interviewing said, and they don't have their name, or at least I don't have their name right here. It just says researchers. The researcher said, "We do a fairly good job of helping people become abstinent from alcohol and other drugs, but as a country, we're horrible at providing any continuing care after initial abstinence period." Oh, his name is John Curtin at the UW-Madison he's a psychology professor. So he has a degree in, how this cycle works. So they got a grant from the Aurora Healthcare Company for $3 million to start working on this grant. There was a clinical trial in 2014, and it showed that patients recovering from alcohol dependency reported fewer risky drinking days while using this app that offered supportive services. So if you were, I suppose, driving by where you used to drink, the phone would alert you and say, you shouldn't just remind yourself of that behavior. And he said the focus has been trying to develop a system to provide essentially a kind of support you would need to get in a 12-script group, but in real time where you need it. Because when you're in groups, you are being supported by other people, and you feel supported. When you're out in the real world, and there's a crisis, or there's a trigger, or whatever it is, it's harder to go, that's a trigger, that's a crisis, step back, because the emotions start to take over. And I have always said, and I will continue to say, abuse is the gateway drug. Okay, so now I'm on August 20th, the Marshfield News Herald article, Opiates, Alcohol Shorten Lives. So I just have a little bit to read here. It's a man named, it's Dr. Decker. Dr. Chris Decker. So he says, the burning issue that we have in front of us is that we have an out-of-control opioid problem. Okay, first of all, let me just say something. We have an opiate problem because we had doctors over-prescribing opiates. This is a doctor. That other guy was a doctor of psychology. You didn't give out opiates to people that had psychological problems. You gave them out to people that had pain problems, and then you gave out too many. So it's kind of weird for me and a little frustrating for me to read about how this doctor's saying we have an opiate problem when I know doctors were part of the problem. We have a growing alcohol problem, we have a growing suicide problem, we have a growing opioid problem. I think it's safe to say that alcohol, opiates, and suicide have impacted either directly or indirectly almost everyone in the state of Wisconsin. And he said we had the decline of heart disease and strokes. That means people started to eat healthier, probably, possibly, less stress, all that. And these are the national killers of the United States, heart attacks and strokes. They dropped 40% since 1999, yet there is an increase in opiate, alcohol, and suicides amongst young people. So the study found that Wisconsin's drug and alcohol deaths have more than tripled from 593 in 1999 to 1,985 in 2017. These numbers are incredible. So what does that really say about the state of Wisconsin and addiction? Now I'm going to read, this is Saturday, September 7th. Again, the Marshfield News Herald. Wisconsin awarded grants to fight against the opioid crisis. So now we're going to get money, big money, to help fight this crisis that was fueled by the pharmaceutical industry and other responsible parties. But it was blamed on the patient, even though the patient went to the doctor for care. So the department awarded $932 million in state opioid response grants to the United States and territories. Wisconsin has received $11.9 million of that money on top of the $18 million already awarded in the past year. So 18 plus 12, we'll say 8. So $30 million we've received as a state to help fight the opioid crisis we have in the state. California accounts for nearly 70 million. California also has a way larger population than Wisconsin. Wisconsin ranks 29th among the 55 locality grants awarded. So we have a smaller population. We still have a problem. We still receive the funding due to the population and the crisis. Wisconsin Department of Health Service will also receive $5.2 million from Centers of Disease and Control and Prevention, part of a $300 million award to states and even some specific U.S. cities to closely track both fatal and non-fatal overdose data. So the federal government is giving the state funds to help fight the opioid crisis. Opioid makers easing own pain. Do you understand that title? Opioid makers easing own pain. This is in USA Today. This is dated September 13th. Drug firms settle lawsuits with tax breaks in mind. So the federal government was like, we'll give you a tax break if you settle these lawsuits that the states are taking against you. The states took lawsuits against the opiate companies or against the pharmaceutical companies because they're saying we have to spend tax dollars fighting this problem that you created. So the states are blaming the pharmaceutical companies. And in Oklahoma, the Attorney General announced in March that Purdue Pharma, which was the biggest producer, would pay the state $270 million to settle a lawsuit. But now the federal government's giving them a tax cut to settle these lawsuits. I don't have the paper, I must have thrown it out, but Purdue Pharma is actually declaring bankruptcy to deal with these lawsuits, and that's how devastating, that should tell you just how devastating this is to America and our country. And I've always said pharmaceutical companies are the biggest drug dealers you'll ever have.